Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
Hello, everyone. Welcome back to Cardiovascular Matters. We hope you enjoyed last week's episode, which was a special edition honoring Dr. Walker and his team for the Critical Limb Ischemia Impact Award for 2024. This week, we're gonna actually go back and talk about some subjects that we've touched on in the past, but we're going to take a deeper dive in some technologies that are becoming available called renal denervation. And that's for the treatment of hypertension. And some episodes ago, we did an episode on hypertension and talked a lot about the medications that are available for hypertension. But there's a lot of patients out there that get on multiple medications and they're still on the high end of normal, or they're not normal. And they're taking, they're trying to work out a plan and get, try this medication, titrate that one, up that one. And medications are great and they're life-saving, but they're not without their side effects. And so anyway, this new technology that's just been approved by the FDA in the last probably, 6, 7 months, 8 months, called renal denervation. There's a couple companies that are available now that are got different approaches, but essentially do the same thing. And today, I wanted to ask Dr. Walker to touch on that because he was actually involved as with some of the early trials and things, and certainly involved in some of the development of some of these technologies with the companies, and is using them now. So, Dr. Walker, talk to us about hypertension, what you're seeing out there with those types of patients, and then this new treatment.
Sure. So, Terry, hypertension is a very common problem. It affects all societies. It's particularly prevalent in Blacks at this point, and can be quite lethal in that group. But it's a lethal disease in most people. And we use different definitions for high blood pressure based on age, sex, etc. In the general population, we're saying anything above 140 over 80 is high blood pressure if it's consistent and sustained. In fact, in younger patients, it's probably 4 less than that. That would be normal. But the reason that high blood pressure is treated is that it's a lethal disease. So the pressure inside the arteries are higher, and therefore the heart has to work harder to pump. So the heart thickens. That's a problem because the muscle is working out against resistance. Just like if I went to the gym and used weights, my muscles would get bigger. Well, the heart does this, but the heart is a pump. And in order for the pump to work, it has to first fill. Now, if the muscle that's filling is twice as thick as it should be, it's going to be harder to fill it. Just like if I gave you a balloon and said, inflate this balloon, and I gave you one twice as thick and said, now blow it up, you'd feel like your ears were going to burst because it would be so hard blowing that balloon up. So one of the first effects is that the heart muscle starts to thicken, but there's so many other effects. It is injurious for blood pressure to remain high. Therefore, it can result in coronary artery disease or blockages of the arteries to the heart. Or it can result in carotid disease or blockage in the arteries going to the brain. This is a problem. In addition to that, the kidneys are very sensitive to blood pressure. And if our blood pressure remains high, over time, we develop a condition with a big name. We call it nephrosclerosis. But what it means is the individual functioning units of the kidney, things we call nephrons, which help to make urine in the first place, get destroyed. And over time, we can end up with kidney failure. And so if we look at the causes of people on dialysis, the 2 biggest causes by far, overwhelmingly so, are chronic high blood pressure and diabetes. And certainly when we put these two together, and many patients have diabetes and hypertension together, the impact is greater. Hypertension can also help cause aneurysmal disease. It's associated
Right.
with greater likelihood of peripheral artery disease. So it is a killer disease. And it has long been demonstrated that as we lower blood pressure, we improve outcomes, regardless really of how we lower those blood pressures with medicines. But there are problems with medicines. Most medicines are poisoning some normal system in some way, shape, or form. That's how they work. And
Right.
so they can cause problems and there may be side effects. Some of the very first drugs that were used to successfully treat blood pressure were diuretics, the thiazide diuretics. These are certainly very effective, still used today,
Hmm.
but they can make you sensitive to sun. They can actually dehydrate you in certain cases. If you have
Right.
sulfur allergies, they can be a problem. That same list is true across the board of blood pressure medicines. And I frequently see patients who come into the office and say, Doc, yeah, my blood pressure's high today, but I think it's just white coat syndrome. And I ask, well, are you measuring your blood pressure at home? Not really, but I'm sure I don't have high blood pressure. And I'm surprised at how many people stop there and just say, yeah, it's white coat syndrome. Well, if one gets an EKG or if one does an echocardiogram and we see that the heart is already thickened, then
Right.
that's not white coat syndrome. That's high blood pressure that should be treated. Because if not, there's an increased risk of stroke, an increased risk of heart attack, an increased risk of kidney failure, all of these other things, which clearly subtract not just quantity, but quality of life. I view both of those as very important because nothing's worse than a big stroke where you can't move one side of your body
Right.
and you're imprisoned in your own body. So, control of blood pressure is crucial. Now, typically, when we're controlling blood pressure, the first three classes of medicines that we use, and often it takes more than one medicine. In fact, it frequently takes three or more medicines to control
Yes.
blood pressure. But usually, that first three classes people tolerate fairly well. There's some people who don't even tolerate those first three, but typically, when we get beyond that, it is very difficult to tolerate those medicines. And so people have looked into other ways to lower blood pressure to see, if we can do a better job. There's a second
Right.
problem with medicines. You have to keep buying them. Some
Hmm.
people don't take them, or they forget to take them. Some can't afford to take the medicines. And so techniques have been looked at to lower blood pressure. One of the early techniques that showed promise was the use of renal artery angioplasty or uh, opening up the artery
Hmm.
that goes to the kidney. That first was done for a condition called fibromuscular dysplasia, more common in women. But
Hmm.
balloon angioplasty of fibromuscular dysplasia was very effective because there are a
Hmm.
series of webs. We would
Hmm.
open up the blood supply to the kidney, and when you do that, blood pressure falls because when the
Right.
kidney senses it's not getting enough blood pressure because there's an obstruction in front of it, it makes things like renin.
Hmm.
And renin makes the body retain fluid. It makes the body create angiotensin, which makes arteries squeeze. And all of these things result in blood pressure going up. So, with fibromuscular dysplasia, balloon angioplasty alone often cured those people of their high blood pressure. Now, we typically divide high blood pressure into what we call primary and secondary. Primary means we're too dumb to figure out the cause. Secondary means we're bright enough to figure out the cause. It may be an adrenal tumor, or it may be kidney dysfunction, or it may be that they've got a blocked kidney artery. Those are what we call secondary forms. But still, about 90% of blood pressure that right now we call primary. And I'm quite sure in the future we're going to realize we're just not smart enough yet to figure out all of those causes. But I think we'll get there at some point. Now, I've mentioned the first treatment was just balloon angioplasty, but balloon
Hmm.
angioplasty did not work well for the blockages right at the origin of
Hmm.
the kidney artery that were from atherosclerosis. And so people then started to use stenting there.
Right.
And
Right.
stenting in the appropriate cases in patients who have blood pressure that cannot be controlled with medicines or who have uh, worsening kidney function and still have a kidney that's of normal size often benefit from renal artery stenting. And I
Right.
can't tell you how many patients over the
Uh,
years I have found like that. Now, some of the trials with renal stenting were fraught with complications. The complication rate was very high. That should have never been so high.
right.
Secondly, they were treating patients with minor lesions. Well, that won't help a patient. If there's not a significant blockage, fixing it isn't going to help. There were a lot of technical errors. And so in short, this sort of fell a little bit in disfavor. However, when done appropriately, still
Yeah.
it is a wonderful procedure. But more recently, a lot of people have looked at a process called renal denervation. So ultimately, what makes blood pressure go up is either the heart's pumping really hard and strong, therefore creating more pressure, but usually the case is because arteries are squeezing down. And if we can lessen that squeeze, which is managed by our nervous system, that's what determines the sympathetic nervous system, as we call it. That determines how much our arteries squeeze. And this is
Hmm.
a normal response. When we go from laying down where blood is easily returning to our heart and stand up, what stops us from getting weak because some of that blood is not returning at the same rate with the veins is the artery squeeze, maintaining our blood pressure.
Hmm.
And so the autonomic nervous system is an important part of regulation of our system. And early on, there were surgeons who looked at this and said, if we can disrupt the autonomic nervous system in people who have uncontrollable blood pressure, because early on we didn't have as many medicines as we did, we might be able to lower blood pressure. And they did this. They actually
Hmm.
did a major surgery and they disrupted the sympathetic nervous system. They actually cut parts of the sympathetic nervous system. Now, this was a big surgery. People often had side effects when they would get up suddenly, they felt weak. And so it was used in last ditch cases, but really
Right.
not much more than that. But others then started studying this and they said, it seems that the most important of the nerves to disrupt, of just a few, are the nerves around the arteries that go to our kidneys. And if we can disrupt those nerves, or a process we call renal denervation, or
Hmm.
basically killing those specific nerves only, we don't affect the other nerves in the body, but we affect this and we can lower blood pressure. So trials were done, and this showed that this technique could absolutely lower blood pressure. Now, again, the trials were such that mostly it was only patients on a gazillion medicines who we
Right.
couldn't control. And so we have to look at that in that sense. But some of the earlier trials in patients with less severe blood pressure showed really profound reduction in blood pressure. And certainly for the patient who's on 4 or 5 medicines and is miserable on their medicines,
Right.
this really was helpful. So recently, this has been reapproved. I was one of the early trialists for forms of renal denervation, and we're doing this via several different methods now. There are many
Okay.
things being evaluated right now. The two that are approved are means by which the nerves are heated and we damage it. One of those is a product using ultrasound, focused beyond the wall of the renal artery, and it destroys those nerves on the outside of the vessel. The other is a radiofrequency ablation, which uses heat inside, but the artery, and that burns the nerves and kills
Hmm.
those. Now, there are other things being looked at and being trialed, things like injections into the renal arteries in order to kill the nerves, other techniques such as that. And those are not yet approved, but there are many things being looked at this point. But what has been shown in renal denervation pretty consistently is a drop in blood pressure.
Right.
And this has been shown to occur without a lot of risk. The likelihood of injuring the arteries is incredibly low in the trials that we looked at before, and the outcomes have been profound. Now, since this has started, I've had several cases where I've just seen amazing results. I've had one patient who was on 7 medications, and we could not ideally control the blood pressure. And following renal denervation, this patient is on 2 blood pressure medicines. and has a completely normal blood pressure. In fact,
Wow.
following the procedure, the patient was still on 4 medicines. We had not stopped more. And the patient came in and said, I'm kind of feeling weak. And sure enough, blood pressure was actually
Low.
quite low.
Yeah.
And we'll have to see. We'll have to see if this blood pressure comes up over time. But I'm not anticipating that to be the case. And I think it causes me to wonder, will this in the future for anyone with severe
Right.
hypertension be a treatment that should be considered? The advantages of a process like renal denervation is you can't forget your medicine. It's a one-time thing and it's
Right.
done. It's you do it and you follow. Now you still would need to monitor blood pressure because it may not bring blood pressure totally back to normal by itself, but it could. And then I guess the other thing we must ponder down the road is, will we be using this in earlier stages of blood pressure that's elevated? And the reason I mention that is high blood pressure begets high blood pressure. When blood pressure is high, it starts to affect the kidney. The
Right.
kidney being affected raises our blood pressure, and it's a cycle that gets worse and worse over time. Might it be in the future that in those people who have very strong family histories of hypertension, who have hypertension while they're young and while they still think that nothing can hurt them, because many of these people don't take medicines,
Right.
might a procedure save that patient's life in the long run, or certainly
Prolong it. Yeah.
prolong or improve
Yeah.
it?
100%.
And so, I think renal denervation is something we must follow carefully. It is, I think, a promising technology. I can tell you some of these recent patients have been tickled pink with the fact that we've had several patients come off of their medicines, and all of these were on at least 4 medicines
Mm-hmm.
that we did. And so time will tell us what's going to happen with this. I doubt everyone is going to have such a perfect result in the future. Uh, I doubt this will work very well if the kidneys are already shrunk. I think there's things, we have to approach this with caution, like anything we approach in medicine. But I do think that this can be a life saving and
Mm-hmm.
important procedure in the future for people with blood pressure. And if I have one shout out to people listening, it's
Mm-hmm.
don't just discount high blood pressure recordings and
Right.
say it's white coat syndrome. Have your doctor at least get an EKG to see if there's evidence of left ventricular hypertrophy, or better than that, an echo. If your heart is thickened, if the left ventricle is thickened, you don't have white coat syndrome. You have hypertension. The earlier you treat it, the more likely you are to avoid the long term problems associated with that. And this could save your life. This could stop you from having a stroke. And I think this is very important.
100%. And just for everyone listening, we've used the term white coat syndrome a bunch. I use it as well. I guess within the industry and within healthcare, that term came up from patients that had normal blood pressures out in the parking lot. They walk into the doctor's office. They're there in the exam room, and here comes the doctor into the exam room, and it creates an excited state, and their blood pressure goes up, and that is a known, I guess, syndrome or known thing that happens, but. People hear that and they believe, well, I'm just excited or nervous because I'm here. And what Dr. Walker is pointing out is the fact that uh, if you perform those 2 tests that he talked about, and you see you have a thickening of the heart, or on the EKG it shows up that the heart's working a lot harder than it should be, uh, you don't have a white coat syndrome. You have high blood pressure, and there's nothing more impactful to me is that when I see someone, um, young or old, that's had a stroke, and I think you made a comment earlier where you're basically a prisoner in your own body, and I've certainly seen that, and uh, you know, be tested for your blood pressure is probably the simplest, easiest procedure that can be done in a pharmacy or anywhere, and Dr. Walker's given you the baseline of where you should be, and if you're above that, you certainly need to be checked. And there's some great medications if you're just a little north of normal that can get you back in line. But if you're in trouble, these new treatments are certainly out there, and I can just tell you, I worked for one of the companies that developed one of the technologies and followed this for the last 10, 15 years as they were going through the development. The early clinical trials, they were taking the absolute toughest, most difficult, what we would consider train wreck, malignant hypertension patients and trying to fix those. It was very difficult to fix them, but we fixed a lot of them. And through a series of, I think, 2 or 3 rounds of trials, the FDA approved it now. And I'm in complete alignment with Dr. Walker, thinking that if I'm on 2 or 3 meds and everything's great, hey, I'm probably good to go. But if I'm on 2 or 3 meds and I'm getting lots of side effects or constantly having to go back and see my doctor to tweak this med or change that med or let's try something different, and I'm still high, I'm going in for renal denervation of some sort. And I'm going to get that addressed because if it can knock me off of, let's say I'm on 3 or 4 meds and it knocks me down to 1 or 2 or none, I'm doing that because there is the economic component of having to buy the meds forever. And then there's also the just having your body deal with, those medications in terms of side effects. So,
Even as a doctor, Terry, sometimes I forget to take medicines. And it's just the way it is. I mean, there are things that come up and it's
100%.
easy. And so compliance is a very important issue too.
Especially if it doesn't hurt,
Yes.
I mean, hypertension doesn't hurt,
Doesn't.
I was in the eye business and we treat glaucoma, which is high pressures in the eye. It doesn't hurt. So people would think, well, I don't need to take this medication. It's very expensive because it doesn't hurt. But in the long run, like you said, I mean, the prisoner in your own body, the stroke is just not where you want to be. And that is life-changing, life-altering, and of course, it'll kill you. So anyway, I think incredibly good talk and focus people on the fact that hypertension, there's a lot of options out there for people today. And they should get in and see their providers and know what your blood pressure is, and then also make sure you stay on top of it. And Dr. Walker, thank you so much for bringing this to our attention and also giving us great information as you were an early investigator and understand this probably more than most. Thank you very much.
Thank you, Terry.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.